Hello and welcome to Black Doctor Speak. I am Ellis Dean, a senior project manager with blackdoctor.org. And once again, we are joined by the incomparable Dr. Michael LeNoir. How are you doing this evening, Dr. LeNoir?
Well, right now, I'm trying to figure out what incomparable means, but put down, I'm doing fine. I'm glad to have the opportunity to wish everybody a happy holiday season, regardless of what you celebrate. We've got a lot of things going against us, but we put down on the list. We still have a lot of things to be thankful for, but I want to wish everybody happy holidays. Today, our program is going to be a little bit different. You know, we've been talking about the coronavirus epidemic, but we haven't really talked about its impact on your children or your grandchildren. And so that's what we're going to focus on today. Our special guest who's agreed to join us is Dr. Donna White-Carey. She's a pediatrician. She's the current medical director of case and disease management for a large county medical managed care insurance plan, and host and producer of the very popular Talking with Dr. Donna show here in the Bay Area. And we definitely want to welcome you to our program. You know, this week there were a couple of vaccines released, and so consequently, Dr. Donna, the big question is, are you taking the vaccine?
Well, first I want to say hi, Dr. Mike, and hello, Ellis. Thank you so much for having me on the show. Merry Christmas to all of you out there.
We're all festive today. We got
we are. It's Christmas time, my favorite time of the year.
I think this was a bit much, so there you go.
All right. Well, to answer your question, yes, I do plan on getting the vaccine when it's my turn. I think that it is really important for us as healthcare professionals to model what we'd like our community to do. I'm pretty comfortable with the science and the data and the studies that have been done for both vaccines that are now available. You know, we have Pfizer vaccine that's available, and now the Moderna vaccine is also available. Both of them have pretty good, 30 to 40,000 people that they've tested it on, pretty fair distribution of ethnicities. So there have been, there's white people, there's Black people, Asian people that were involved in the study. And so I'm feeling pretty good about the data and about its efficacy. And so when it is my turn, I will definitely get it.
You know, always we've been talking about African Americans being reluctant to get the vaccine. They're not the only ones reluctant to get the vaccine. Right. And they have every right to be concerned, don't they?
Absolutely. Absolutely. I think that African Americans, we have every single right to be skeptical of the science, to be skeptical of the federal government. We have a long history in this country of abuse of science against Black people. So we have every right to be cautious and every right to ask questions, and our questions should be answered, and they should be answered so that we are satisfied that what they're doing, what they're providing for us is not going to harm us.
You know, these are new vaccines. I mean, you hear it talked about, especially the first two are RNA vaccines. Mm-hmm. What does that exactly mean?
Yeah, so both vaccines, the Moderna vaccine and the Pfizer vaccine, work with a new type of vaccine technology. It uses the mRNA, so a messenger RNA. And what it does is it encodes the gene. So the genome of the virus is encoded in a messenger RNA. It is then, injected into your arm, and the messenger RNA then causes the body to create proteins, right, of the virus. Then your body recognizes those proteins as something foreign, and then your body creates antibodies. So it creates basically the fighter cells to fight against this foreign virus that it didn't actually recognize. And then the messenger RNA is destroyed in about 2 to 3 days per the science. So does not stay into your body. It does not encode into your DNA. It's simply a messenger mRNA. So it brings it in, and it's a carrier. It kind of carries in the virus in a safe way into the body so that your body can then see the virus and start to build antibodies to it.
Now, you're satisfied that the studies that they've done have been adequate, have been scientific. The vaccine was certainly rushed. However, you're comfortable.
I am comfortable. And I think I'm comfortable for, like I mentioned, I'm comfortable because they did do a pretty broad, sample of people in their trials. Of course, as we discussed, lots of people were skeptical of it. So not a lot of people were like running to sign up to be a part of the studies. But, 30, 40,000 people, that's a pretty good representative. I think for most part, about 50% of that was Caucasian, and then, the Blacks, Asians, Latinos were sort of somewhere in between 10 and 25%. And so I feel like it was a good broad sampling. Yeah.
No, go ahead. But one of the things that I think most people are concerned about, obviously, is that there's so many vaccines. How do you know which one to take?
I know. That's a really good question, right? All of the vaccines are, there's about 9 that are in the pipeline to be made and produced and then distributed into the United States. The first 2, the Pfizer vaccine and the Moderna vaccine, both of those vaccines are here now, available for our county, Alameda County. The Moderna vaccine is scheduled to arrive next Thursday. So both vaccines are here. They both have a pretty similar profile of about 94 to 95% effective after taking both doses. And it's really important that you take both doses, because if you only take one dose, you're only getting about 50% effectiveness against the virus. You want to get closer to that 94, 95%. So you want to take both doses. The Pfizer vaccine, you take one dose, you have to wait 28 days, you take the second dose. The Moderna vaccine, you take one dose, you wait 21 days and take the second dose. So very similar in terms of their efficacy and in terms of how you take the vaccine.
We're talking with Dr. Donna White-Carey. We're talking about the whole issue of vaccination for the coronavirus. You have children or grandchildren, you want to ask us questions, please don't hesitate to get in the chat room, and Mr. Dean will appropriately interrupt when we get the kind of questions that you want answered. All right, why not research on children?
Yeah, so, children they're our most vulnerable in our population. So we don't really like testing things on our children that we don't really know what the side effects are. So children are usually the last people who get studied. So first we do adults. And so now that adults have been studied, I think the youngest participant in these studies was about 16 years old. So the Pfizer, I believe, vaccine it has a 16-year-old in trial, and then it'll move down to younger and younger until we finally get to our newborns.
All right, now what about school? I mean, we talked about athletics with Dr. Warren Struddy. What about how do you make decisions about whether to send your children in direct schooling? I mean, we know that the distance learning is not working like it should for Black children. And for children with special needs, and for Latino children, for any children.
Right.
How do you make that decision about whether to send your children back to school?
Yeah, so that's a really tough decision. I have 2 young children of my own, and I also sit on the coronavirus task force for my children's school. And we had lots and lots of discussions about whether or not to bring kids back on to campus. And part of the reason is because our kids are really suffering, right? They're not just suffering academically, because it's really hard to maintain the same academic rigor when you're sort of zooming in and you're checking in with them once every hour. Then when they're sitting in the front of you in the classroom. And then for their social emotional learning. I mean, at the beginning of the pandemic, my son was super excited to be home and not have to worry about getting up and getting dressed and all of those things. But, after, months and months of that, they started to miss their friends. They start to miss the engagement that they're used to having. And so for those reasons, you really want to try to figure out, how can we have our kids return to school and be as safe as possible? So there are several things that we thought about when we were thinking about bringing our kids back to school. And and how we can decrease the risk and the spread of the virus. And we know outdoors is safer than indoors. So if you're able to have outside classrooms, that's going to be safer than bringing the kids inside to the classroom. Also, the number of kids that you're having within the classroom. So we were trying to do no more than 6 to 8 kids per classroom. That is not, a lot of school districts, that's not possible for them to have such small classrooms. That means you have to increase staffing. And so you have to look at that in terms of a budgetary cost. And then you also want to look at, whether or not you're able to sort of keep them with their masks on and keep them with their shield on if possible. So those are all things that you want to take into consideration. The other thing that we looked at was we looked at the studies. So because coronavirus came over to the United States later than it did in Europe, most of our studies are coming from Europe and coming from Asia. And what they did is they looked at kids who are going to school and trying to see, do these kids, are they passing the virus to each other? So we looked at those studies, and those studies showed that in the majority of the cases, when a child had coronavirus under the age of 10, then that more than likely that child got infected by an adult. The studies were showing that children to child transmission is much less likely than a child to adult, or excuse me, adult to child. So that made us feel a lot more comfortable. Again, that's data from kids who are 10 and under. So we have to separate ages, because we found out that, and from the studies, that kids who were 10 and younger, they have very little transmission from child to child. However, when you looked at the older kids, the adolescents and the young adults, that was very different. They transmit to each other just like adults. So the school has to take an approach where they might have a different, schedule and look for how school coming back together in elementary school versus in middle school and high school.
Well, what I've what interests me as an immunologist is what's different about children that they can handle this virus more effectively, and what about the syndrome that has been associated with a virus infection in children?
Yeah, so that syndrome is really interesting. It's very similar to a syndrome that was already present in our environment. We knew is called similar to something called Kawasaki's disease, which is a multivascular disease. And we don't quite understand how that disease occurs either. And so coronavirus seemed to trigger a same sort of immune response as this Kawasaki disease, which means it involved multiple systems. So it's called multi-organ inflammatory syndrome. And because it infected not just one area, but multiple organs and multiple areas in the blood vessels of a child. So we're not quite sure how that happens. But I'm sure as we continue to, have this virus, and researchers will continue to look at it, and hopefully we get some answers.
Yeah, I think what intrigues me is that since children are so resistant to this particular problem, maybe there's something about children that we can harness and relate to adults that will prevent them from being so sick. Do babies get coronavirus?
Yes. Unfortunately, the answer is yes. So we know, again, that more than likely the children are not the initial vectors, but they're actually getting it from their parents. So I had a patient actually born healthy, but mom discovered that she had some symptoms, very mild, cough, runny nose. And after giving birth, because of her symptoms, we tested mom. She was positive for coronavirus. And then we tested dad, and he was positive for coronavirus. So the baby went home with mom and dad, and in about basically 2 days later, so the baby was about 4 days old, that infant was admitted to the hospital, and that infant had coronavirus. So it is possible to spread to infants.
Our special guest, Dr. Donna White-Carey, we're talking about coronavirus in infants, children, and adolescents. If you've got a question, any questions there, Mr. Dean?
Yeah, there have been a couple of questions. One of them really about, it's kind of hard to be able to determine at this point in time, but there was a question from Sunny, and she was asking, what about the long-term effect of the vaccine? And is there a chance of possible birth defects in the future for people that might want to have children if they take the vaccine?
So they didn't set out to test pregnant women in this study, but there were some women who became pregnant while in this study and have since given birth. And the children, thankfully, seem to be fine. They're not harmed. And there were some who were later on in the pregnancy, earlier in the pregnancy. And so it's hard to say with certainty, but we can say from some of the data that the women who were pregnant in the study, that it does not seem to affect the babies. And I believe both vaccine manufacturers have stated that this vaccine is safe for pregnant women to take.
Go ahead, Doc.
Oh, yeah, I was just going to point out that we had Dr. Lakeisha, who is an OB/GYN. She did a short video for us, and it's on the Black Doctor site. And she talks about the flu vaccine in terms of pregnancy, and saying how it is a good thing for pregnant mothers that it's safe. It's safe for pregnant mothers to take the flu vaccine, and how that passes through the placenta to the child. And so, again, this is a new vaccine. So all of the studies are still underway, and we're still trying to get information on the vaccine. But if it behaves in a similar fashion, then it should be safe for pregnant women. They just haven't tested them directly.
Correct. Absolutely.
Dr. Donna, could you discuss herd immunity and what the difference is between this virus and so many of the other immunizations that we give to children?
Yeah. So herd immunity, first of all, requires enough people in the community having the vaccine and having protection against the virus for it to work. So I like to think of herd immunity, sometimes it's a little bit easier to think of it like a neighborhood. So I own a home, and in my home, I fireproofed my home. My neighbor did not fireproof his home, but the neighbor 2 doors down also fireproofed his home. So now there's a fire that's in the community, but because I fireproofed my home and my neighbor 2 doors down fireproofed his home, then the neighbor who did not fireproof his home, his house is still protected because we protected our homes. It kind of allowed that home to also be protected. And that's how herd immunity works. Once there's enough of us in the community that has the vaccine and is protected against the virus, it will protect those in the community who have decided not to get the vaccine.
Now, what about the whole issue of how does a parent or a grandparent tell the difference between whether a child has a coronavirus infection or a regular viral infection?
Yeah, so that's going to be tough, right? Particularly as we move into the flu season, because coronavirus and the flu really look very similar. Cough, runny nose, fever, sort of feeling ill and body aches. Those are hallmark signs of both diseases. There are some things that coronavirus can do that the flu doesn't tend to do, such as losing your sense of smell or your sense of taste. And that's more of a hallmark sign of coronavirus. But if you're younger and your child may not be able to say, hey, I can't taste that, or hey, I can't smell that, you might find them doing things like refusing to eat their favorite foods, which they would normally devour, but not really desiring it because they don't taste as well. So the key is, though, because you cannot really tell the difference between the two viruses, if you are concerned or you feel like your child is very sick, it's really important that you take your child in to see their healthcare provider.
You know, the other thing is that one of the things that we've been concerned about for many, many years is the whole issue of children getting flu vaccines. Mm-hmm. Tell us why it's important for a child to get a flu vaccine, even though we're worried about the coronavirus.
Right. So, you know, one of the studies that, again, looking in European studies, they found the kids who were in elementary school, when they were sick, they actually were co-infected, which means they had both coronavirus and the flu. So it's really important that you protect yourself against the flu. Now, the flu vaccine is different than this coronavirus, the vaccine and the way we're taking it now, because we know that every year we look at, the flu strains that are in the community, and scientists do their best to guess which flu strains are going to be present during the flu season. And then they create a vaccine against those particular strains. And so it's important that you protect yourself against the flu and coronavirus, particularly in this season for our kids. The flu vaccine is so important to prevent them from getting ill.
One of the things that bothers me the most is that some of the simple measures that you have to take to protect yourself against coronavirus infection, especially your children and your family, are relatively insignificant. Why do you think there's been so much resistance to doing the few things, the standing in place, social distancing, the mask, the washing your hands? What's been the problem?
I really think that the problem started with the messaging about the virus. When it first came out, everyone was talking about how this virus is a virus of elderly people and how it does not impact children. It doesn't impact young adults. Really, if you're over the age of 65, you're the ones that are supposed to be scared and nervous. And because of that messaging, I think it allowed many people who are younger than the age of 65 to feel like it wasn't for them. Didn't concern them. It didn't bother them. They didn't need to make any changes in what they were doing. But now that the virus has been with us for almost a year, we're seeing that because of that sort of cavalierness of our younger people and people not taking it seriously, not wanting to wear a mask, not social distancing, continuing to gather together, that it's really allowed this virus to spread. And coronavirus is very social. It loves a good party. It loves for you to hang out together, and that's how it spreads. So yeah, it's all for you, having a gathering and not wearing a mask. But that has allowed this virus to spread all across our country.
Yeah, I see that virus outside my door with its thumb out every time I drive out my door. I lock my doors.
Don't pick it up.
I don't stop till I get to my destination. I left this toward the latter part of our discussion because I want to discuss the value of vaccines, because I think let me just say this. I believe that life without a coronavirus vaccine really kind of limits you to what you can really do. That means that if you go anywhere where there's a crowd, a jazz concert, a large religious gathering, a family reunion, and you're not vaccinated, then you're less likely to get infected if other people are vaccinated. But if you do get infected, then you're going to have the same problems. Mm-hmm. But we've had vaccines for lots of things. How effective have those vaccines been?
Wow. So if you think about, in the last 100, 200 years, we think about some of the diseases that were present that we don't hear anything about anymore, that because they've been eradicated because of vaccines. You think about smallpox. We used to be worried about smallpox, and now you don't hear anything about smallpox because we have eradicated it because of the vaccine. A vaccine that most people are aware of now is, if we look at measles. The measles was super effective campaign. In the late 70s, the CDC decided that they wanted to do a vaccination campaign against the measles. And by the year 2000, because of the vaccine campaign, there were no further cases of measles that started in the United States. Now, unfortunately, we live in a worldwide, and not all countries were vaccinating against measles. So we still had measles cases coming into the United States, but actually starting in the United States, very unlikely because of the vaccine. Polio. I mean, when is the last time you've heard about someone being impacted, born and raised in the United States, by polio? Another great example of how we've taken a disease that was maiming people, killing people, and now we very rarely hear anything about it because of the effectiveness of our vaccines. So very important.
Any questions on Mr. Dean?
There was a question. It was about a medicine that I wasn't quite sure what it was. It was from Carla. She said, has ivermectin been shown to prove and even cure COVID-19? And she's saying she heard some reports. I don't know what that medicine is. I've never heard of that.
Yeah, I'm not too familiar with that medicine, but I will say that we have not found a cure for coronavirus.
Right.
So we know that it might work in a combination with other things, but we definitely do not have a cure for coronavirus at this time.
Yeah, one thing that's not been discussed, though, is the whole role of vitamin D in coronavirus. I think that I happen to be a good associate with one of the world's experts in vitamin D, and he is absolutely convinced that increasing your vitamin D really makes some protective measures. You know, it's always a little concerning to me because, you know, this is not going to be the last pandemic.
Right.
Point of fact, we've had, and I would like for you to discuss that piece, we've had some information about a virus in England, which has a different infectivity, maybe a different mutant virus. But I saw something today on CNN. It made me sit up and take notice. It's a virus in the Congo, deep in the Congo. It is killing people. It is not Ebola, and they don't know exactly what the virus is. So the last time and these people, this was like a 30-minute CNN report on this virus in the Congo that not only spreads rapidly, but kills more intensely. This isn't the last pandemic, is it?
No, I don't think so. I mean, we have had pandemics. You know, we had the flu. We have flus every year, right? And what we know about the flu is that it changes from year to year. We can't say that one strain of the flu virus comes every single year. That's why the flu vaccine is constantly changing. The thing about viruses, like what they do so well, is mutate, right? They mutate, they change. Different strains, they find ways to survive. They want to live too. And so because we know that viruses mutate, I'm not overly stressed by the fact that there's a new strain that's of coronavirus that we found. We should have expected that this virus was going to be smart enough to mutate itself. It's yet to be seen what this new strain does and how this new strain is different from what we currently have. So I think time will tell. But viruses are smart. They are, everywhere in our world. And so this will not be the last time that we have to deal with something like this.
One final question. Obviously, we were very concerned about the fact that African Americans have kind of led the list in deaths from coronavirus. We've heard all kinds of explanations. What is your thinking on why we have been so susceptible to this virus and why we have suffered the casualties that we have suffered?
Yeah, so a couple of things. I mean, I think just prior to the pandemic, we had health disparities in our community. African Americans were at a higher rate of dying from heart disease, from cardiovascular disease, from stroke, from, cancers. We are sort of at the top of that list in almost every disease category because of the racism that has existed in our healthcare system and how we have been treated or not treated for various diseases. And so I think that the virus, because it likes a weakened immune system, that's how it survives and thrives on people who have an immune system that's not really strong enough to mount a good response against it, that it makes sense that African Americans have higher rates of hospitalizations, higher rates of being in the ICU, and higher rates of death because we're starting from a place that was not as healthy.
Well, anything you want to ask Mr. Dean?
I think your point about vitamin D deficiency is well made. I just saw, I pulled up an article here in the Atlanta Journal-Constitution, and they're saying that researchers discovered that 80% of 216 COVID patients at the hospital had vitamin D deficiency. Right. And so while that's not a large number of of people in a study, that still is a significant number of people that's shown to have a vitamin D deficiency. And so if we could maybe close that gap to help protect our build our own immune defenses,
Right.
in conjunction with the vaccine and diet and exercise, we should be able to protect ourselves from whatever strand of coronavirus that is out there.
Right. We want our bodies to be healthy. And, African Americans, it's we have a lower vitamin D level, right? It's harder for the sunshine when we're outside for that to activate our system, and that creates the vitamin D. And it hasn't helped that we've been sheltering in place, right? In the house. And that means that we haven't been outside getting the normal amount of sunshine that we may have gotten before. So it's really important right now that you sort of, take, I think first of all, people should check their levels. So that's something that you want to have a discussion with your healthcare provider, get your level checked, because you can just go buy vitamin D off, at a drugstore, right? And you can say, oh, I'm going to take 2,000 international units of vitamin D. That should be enough. But you could be 4,000, deficit. You don't know unless you have your number. So we know vitamin D is really important in our immune system. It's really important as an anti-inflammatory in our bodies. So, of course, you want to optimize your own immune system, because that's your first line of defense is yourself. So how healthy are you? How healthy is your immune system? Getting the vitamin D that you need, a well-rounded diet, making sure you're eating your leafy green vegetables, making sure that you don't take in too much sugar, not too much carbs, right? That you get yourself up and moving 30 minutes a day, right? American Heart Association recommends 150 minutes a week.
No.
You guys increase it?
You can get by with 11 to 35 minutes now. I mean,
11 to 30, but every day.
You know that 150 minutes was impossible for most people.
That's optimal, Mike. We want to be optimal.
No. So the minimum is 11. The sweet spot is 35 minutes.
Okay.
You and I both know you can be doing 150 minutes of vigorous exercise a week. But in any event,
it's like, if I tell you to do 150 minutes, you might do, 50. And then you're going to be there. Or you might do 35 minutes, and then you'll be there.
One final question. Mothers are in the house with these children. Constantly, obviously since March. Any tips for mothers and how they may be able to stabilize themselves mentally in the house with children constantly for the last 6 months?
Woo.
That's not possible.
It's rough. I can say that it's rough.
That's their role in our lives. All right. Well, Dr. Donna, thank you so much for joining us today. And I want people who hear our podcast to share it with other people, because this is really the only program that I've heard where we talked about children and the coronavirus impact on children and ways in which it impacts them and ways in which you can protect them. So please take the time to share this with your friends and relatives, grandparents. Grandparents, we got a lot to do as grandparents. I mean, it seems like, we were supposed to be the just a necessary asset to the parents during this pandemic. And so I think they need to have this information. So thank you, Dr. Donna, so much for joining.
Thank you.
And like Richard Pryor said, we will see her again.
Absolutely. So before we get to our next guest, we're going to play a short video, and then we'll bring on our next guest. We're going to talk more about today's show is all about protecting your children. So we talked to a pediatrician, and next we're going to have a pediatric dentist come on and talk about. Pediatrician talked about your body. Pediatric dentist is going to talk about your child's teeth. So we're going to play this short video for you, and then we'll come right back and talk to Dr. Winifred J. Booker.
I'm Dr. Mike LeNoir with this week's AAWP Ethnic Health News Report. While the coronavirus pandemic continues to rage across this country, there is some hope on the horizon. New vaccines are now available from two companies, Pfizer and Moderna. The recommendations now are that the first responders, doctors, nurses, and emergency room personnel will get the first set of vaccines. The second set of vaccines will go to people who are on the front lines, bus drivers, patient assistants, and people working in grocery stores, along with those who are over 75. While these vaccines may gradually slow the progression of this virus across our country, it won't be for quite some time. So still remember, social distance, wash your hands, and wear your mask. The AAWP Weekly News Report is sponsored by the African American Wellness Project and blackdoctor.org. All right. So now I'm going to talk about your children's teeth. We very seldom get a chance to discuss this. Children are different. Our special guest is Dr. Winifred Booker. Dr. Booker is a practicing dentist in the Owensville portion of Maryland. She's the president and CEO of the Children's Oral Health Institute, a very successful community-based program that deals with children who otherwise would not have any help. Dr. Booker, thank you so much for joining us. Now, as a pediatrician, I've been making up stuff about dentistry patients for the last 30 years. And so I'm glad to have the opportunity to get some real information. But I think a lot of parents are concerned about now taking their children to the dentist. And what are dentists doing to make sure that when children go, or when they go, that they're safe?
Well, dentists always practice many of the techniques that are being required now with the coronavirus in terms of how clean we kept the office and all the sterilization techniques we used. But in addition to that, we're taking temperatures, we're wiping down between patients, we're changing gowns and allowing time between patients before they're reseated. We are social distancing in the waiting area. For example, in my waiting area, I can see 4 families at a time because I can separate in that way. So we're following the precautions that are recommended by the CDC and doing all those things that I just mentioned.
For our parents, when should you take your child first to the dentist?
It's a great question, but when you get teeth, you should be seen by the dentist. So that's usually around 6 months old, but the recommendation is by age 1 or by the child's first birthday that we want to see the patient for the first time as pediatric dentists and as general dentists, because the truth is more general dentists see children than do pediatric dentists.
And so taking them at 1 year, that's examining them at 1 year is difficult. What about doing a dental exam? How does that work?
Well, there's a couple of ways to do it. And in my practice, I use a program called high chair dental care. But the traditional way to do it is to do what we call a lap exam. And you lay the baby back. The parent is knee to knee with the dentist, and we do the examination that way. But I do a program in my office called high chair dental care, which makes it much easier because a high chair is a baby's wheelhouse. That's where the baby is used to being. And so I find that for most babies, every baby's not going to be compliant, but for most babies, it works out really well. And you can get the exam, you can clean their teeth, you can do hygiene instructions. So I like to use that program in my office. As I said, not with every baby. And sometimes I'm forced to do the lap exam, but it works out really well for me. So it's an alternative to the routine lap exam that we do with 1-year-olds.
Now, what about brushing babies' teeth? I mean, just seems to me a wasted effort, but of course, I'm backwards in some ways, but how important is to brush babies' teeth, and do they require special kinds of toothpaste and things of that nature?
It is absolutely important to brush your teeth after every meal. And babies have snacks and meals more often than I think the rest of us do, because it's a way to calm babies or to get behavior under control. So you want to brush after every meal if you can, but at least twice a day. And for babies, you want to use just a grain of right size of toothpaste or smear on the toothbrush and to brush the baby's teeth. And the way you introduce toothbrushing to a baby is you first brush their lips, and what is the baby going to do? They're going to open their mouth, and then you brush their tongue, and then you introduce the toothbrush to their teeth. And so there's a technique to it. And if the baby is sitting in the high chair, the expectation is that something is going to be put in my mouth. And so it makes it a little bit easier.
Tell us a little bit about your path to pediatric dentistry. How'd you get here?
So when I came out of dental school, I was practicing with two general dentists, and I seemed to get all of the children. I weighed 100 pounds wet, and I had a ponytail, and so they gave me all of the children. But in the community where I practiced, I was so limited because I was seeing so much disease, and many of those children needed to go to the operating room. And so I went back and did a residency in pediatric dentistry. And so that was my pathway to pediatric dentistry.
What are the kind of problems that you see as a pediatric dentist that a general dentist really can't tackle?
Well, you asked earlier on in the interview that about when should the child go to the dentist. Well, that first visit, let's say you have a baby. As I said, all babies aren't going to be compliant, and some babies are upset and they don't want to do it because they perhaps have seen a pediatrician or are upset about getting those inoculations. And so it's called an anticipatory guidance visit, and we're educating the parent about putting the baby to bed with the bottle, or breastfeeding at night at will, or allowing the baby to breastfeed at will. And we want to talk to them about trauma, about cigarette smoking, about secondhand and thirdhand smoke. So it's an anticipatory guidance visit. But one of the things that I've seen throughout my career is early childhood caries or baby bottle tooth decay. And that can be devastating when this child just has 20 teeth in their mouth and 14 to 16 of those teeth are decayed. And that requires the child to be put to sleep under general anesthesia. So that's one of the biggest problems that I see in 2 and 3 and 4-year-old children. I mean, general anesthesia is serious. And so to have to be put to sleep, to have all, your tooth decay or your dental treatment addressed is really quite serious. And most parents, when they get to the hospital and it hits them as to what has to happen, it's quite frightening.
Well, our special guest is Dr. Winifred Booker. She's a pediatric dentist. Now, you know how much dental stuff costs. And so here we have a dentist right in front of us. So if you want to save yourself a co-payment or maybe your bankruptcy, we want you to start, and we want to see if you have any questions for Dr. Booker. Now, Dr. Booker, you are known throughout we call ourselves the Bay Area. I don't know what Baltimore exactly calls themselves. I think they have a Bay thing around there, but you're known throughout that whole area as someone who's contributed significantly to the community. One of the projects that you've had is called Lesson in the Lunchbox. Explain to us, what is the Children's Oral Health Institute? And tell me what this Children's in the Lunchbox Lesson in the Lunchbox all about.
So the Children's Oral Health Institute is a nonprofit organization that I established in 1996. And part of it had to do with all of the children that I was seeing that had early childhood caries and baby bottle tooth decay. And I was frustrated with children returning after I had done all this massive work in their mouths. And, they returned to a tooth decay state. And so I decided that let me begin to empower this generation that I'm working with now. And I was in Walmart, and you can see my lunchbox in the background. And I realized after seeing a lunchbox with Spider-Man jumping off of it, that I could use that same lunchbox and put messages on all sides of it and help to educate kids about it. And so that's one of the core programs that the Children's Oral Health Institute promotes to educate communities and families. We do others called Project Clean Toothbrush. We have a Code Red, the Oral Health Crisis in Your Classroom for teachers. And we actually partner that program with the Lessons in a Lunchbox program. But the program is for 2nd and 3rd graders because they're beginning to read, and it has information about toothbrushing and flossing, and it's in English and Spanish. Inside it has the food plate. And so we have now reached every state in the country. It started out as a core program. And in fact, it started right after the death of our 12-year-old here in the state of Maryland from tooth decay, Diamante Driver, which made national news. And we had a great champion that supported us with this program, the late Congressman Elijah Cummings, who actually rolled up his sleeves and went to about 4 elementary schools with us to present this program. So again, it's for 2nd and 3rd graders. It has a ton of information in it, and it has support information for teachers. And one of my favorite parts of it is it has a reflective sticker on it that says, "See yourself becoming a dentist." And you can actually hold the lunchbox and see the image of your own face in the reflective sticker. And the sticker is in the shape of a smile, and it says, "See yourself becoming a dentist, a dental hygienist, a dental assistant." So the lunchbox, Lessons in a Lunchbox, Healthy Teeth Essentials and Facts About Snacks, is a program that is comprehensive, and it covers careers in dentistry. It talks about diet and food portions and how to maintain your dental health.
What's in that lunchbox?
Oh, I'm glad you asked. So there's a product inside of the lunchbox called Dental Care in a Carrot. And this is the rinse cup. And so you can rinse your mouth out with it. And it says rinse cup. And inside of the carrot case is a toothbrush, toothpaste, and dental floss. And it has instructions to remind you, and it has a Mylar mirror. So the kids absolutely love it. It also it has Braille on it, so that we've gone into, in our area, probably about 4 schools for blind children. And because that's one of the biggest groups that's neglected, or we don't think about their teeth because we're so focused on the fact that they're blind. And so we're really proud of the program. It has reached over 63,000 children in all 50 states, the District of Columbia, Haiti, the Dominican Republic, and I'm leaving out someone. We just made it to the Bahamas this last year.
You know, I saw an article today that, let me just reintroduce Dr. Winifred Booker, pediatric dentist. Do you have any questions, Mr. Dean? Or
It hasn't been any question. I have a question because I have a child that plays sports, contact sports, and I know we see that, and they have the mouth guards. You know, dentists tend to cringe when they see kids playing contact sports. So, are there any suggestions or ways to make contact sports safer, or should they be wearing a mouthpiece in all sports, whether it's contact or not?
Well, yes, absolutely. Like, for example, soccer is one of the sports where kids aren't wearing mouth guards, but we need to collaborate with coaches more. The most common sports where the mouth guard is worn is in basketball. And, you know, a mouth guard comes automatically with the football helmet, but absolutely we want you to wear a mouth guard. And we talk about summer sports and activities. For example, one of the things we talk about is don't go down the slide head first, because what are you going to hit first? Your face, and impact your teeth. But for mouth guards, we feel like every contact sport, you should be wearing a mouth guard. And not sure why every sport isn't encouraging it, because the loss of a tooth or injury to your teeth from a contact sport can be very expensive, not to mention the discomfort that you experience.
I'm sorry, Doctor, if it's dislodged, I've heard the story that if you put it in milk and get to a dentist, that it could possibly be repaired. Is that true?
Well, it has to do with the amount of time. So what we're taught is within 1 hour, if you get the tooth reimplanted, you have a better outcome or a better chance of the tooth surviving. But the whole point of putting it in the milk is because you want to keep the tooth moist. It's also, there's calcium molecules in the milk, and so that's compatible with what we see in enamel and tooth structure. And so if you can have milk, certainly. And that goes back to your sports as well. Is there a kit within the emergency kit for tooth avulsions, and if a tooth gets knocked out? And we encourage coaches to have that as well, so that we have a better chance. If we have to reimplant, there's a better chance of the tooth surviving if we can get it in within 1 hour and the tooth has been preserved in a medium that's compatible with the tooth structure.
Okay. So there's a question from the chat room, and it says, are there anything that parents can do to reduce the likelihood of your child needing braces?
Well, if they're sucking their thumb, you can prevent, try to encourage them not to suck their thumb. But a lot of times braces has to do more with genetics. There's some interceptive orthodontics you can do if we recognize that there are skeletal issues, that it is genetic. And so we can do what we call interceptive orthodontics, and that might head off the need for the full-blown brackets. But a lot of times it's skeletal or it's genetics. And I mean, you may have to just have the braces.
Yeah, seems like every child I know has braces at some point in time. But how can as a general dentist, there's so many different types of dentists that you can be referred to. How do you select a dentist?
Well, in pediatric dentistry, the way they select us for the most part, and in my experience, it has been a word of mouth by parents. Parents find a dentist their children is comfortable with, and moms have a great network. But in terms of specialty care, your insurance company will usually have a panel of dentists who are a part of their HMO or PPO, whatever the case might be. And that's how you might locate your general dentist. And then if you need to have a root canal that may be out of the expertise of the general dentist, he's going to refer you to an endodontist. If you have gum disease that they can't, it's beyond gingivitis or it's more exacerbated than that, they're going to refer you to a periodontist. If you need implants that aren't just routine implants, because general dentists, as the term says, they do just about everything, they're going to refer you to a prosthodontist. So we have 9 specialties within the profession of dental medicine. And so that whatever is the specialty, then that general dentist may refer you, because if your case is bigger than what they've been taught, then that's what they're going to do. They're going to refer you out. And that's how many children end up coming to the pediatric dentist as well, because if they have a number of cavities, then they're going to refer them out to us, because our expertise is behavior management.
I saw an article today in the newspaper here in the Bay Area that said that telehealth dentistry is going to change dentistry forever. Has that been your experience?
It absolutely has been my experience. And I sit on the Maryland Medicaid Advisory Committee. And in fact, when the coronavirus, when shutdown came, physicians automatically were awarded reimbursement for telehealth medicine. And as the representative dentist, I said, well, what about telehealth dentistry? And they said, let us get back to you in a week. And within the week, they came back with it because, I mean, it's not as if dentists can't navigate an oral health situation via telehealth dentistry. And I would agree with that statement. What about people that live in remote communities, or for example, Garrett County is a part of Maryland that's very remote, very few dentists there, and no specialists. And so telehealth dentistry, I do agree, is going to change. And I think that it's going to be a good outcome that occurred because of, in many states, because of the coronavirus, because so many states didn't have telehealth dentistry prior to the coronavirus.
What about insurance? Does it pay for children?
Absolutely. In the state of Maryland, insurance, children are covered 21 and under. And I think that's true with most insurance plans. One of the barriers, though, with insurance plans is that after the age of 6 or 7, they will cut you off in terms of your ability to be able to go to a pediatric dentist, and you have to get a referral from the general dentist. And then they oftentimes will have a panel that will deem that the child doesn't need to be seen by a pediatric dentist. And hopefully we're going to work on that so we don't have that anymore.
Well, there's one question that has plagued me as a pediatrician for a very long time. I mean, it's really been a very important question to me, and I've really not gotten an adequate answer. Who is it that gives you that money when you lose a tooth and put it under your pillow? I mean, is there? I mean, I've been wondering about that for a long time.
Well, it just depends on where you live. And if you come down to the Museum of Dentistry in France, it's a mouse. And in India, they throw the tooth on the roof. And so I think here in the States, we know it's mom or dad or Tinkerbell, maybe.
Well, I wondered, I missed it one time, and I was paid for it. My girls, children always remember stuff that never happened when you were raising them. But anyway, so I'm glad to get at least a partial answer here.
You had to pay double.
Well, Dr. Winifred Booker, thank you so much for joining us. We really appreciate your input, and I think this is a lot of good information for parents that they don't otherwise have. So thank you for all that good information, and thank you so much for what you do in your own community. So a good program today, Mr. Dean, and a lot of pediatrics. We don't see much pediatrics out there on the internet, so we're going to jump the broom on that one and keep going. We're moving into a new year, and hopefully we'll gather together more people who will join us as we start to try to pursue the most important and up-to-date information about contemporary health issues, especially those that affect African Americans. So we'll start next year once again looking at some of the key problems. We'll increase the news that we give you, some health tips we're going to throw in to the mix. So we certainly want you to share our program with other people who may not have had a chance to remember it. And I want to thank you, Mr. Dean, for whatever quality we have really rests with you. That jacket is pretty bad too, man. I kind of like that. That's like your Christmas jacket once a year, right?
This is my once a year Christmas jacket. I bring it out until I get till the moths get hold of it and they start biting holes in it. I'm going to bring this out, and this is my Christmas present. So I look like a present. Looks like
that's good. That's a good one. Mine has a little mothball stuff in it, but I tried to hide that out. But I want to thank those.
Cedar chest. That's what I hear. Cedar chest is what you're supposed to put your clothes in to keep the moths away.
But I want to thank you for what you've done. And I'd like to thank those of you who've taken the time to listen. Remember always, health is your biggest asset. I'm Dr. Mike LeNoir. Protect it.